approach to healing the human body. Dr. Mark Morris is here to tell us about osteopathic medicine.
I am. Osteopathic medicine is a medical discipline that was founded in 1872 by a former Civil War doc named Andrew Taylor Still. And his father was a doctor and a preacher before him. And so he took a different approach to medicine than most doctors do. His initial founding belief was that there is an inherent tendency toward health in our bodies. If we pay attention to that inherent tendency toward health and employ it, then we are going to heal ourselves from most problems. And the proof of that is that we evolved without doctors. And so they're actually a luxury. If doctors were crucial, they would have come before us. So
what motivated you to study in this field?
I had a bone spur in my neck that caused fire to shoot down my arm every night for 5 years. And I went to 11 different doctors. Nobody could help me. I was in horrible pain. I was on a boatload of meds and I was sleeping in a chair for 6 months. And somebody finally said to me, "Why don't you go see an osteopath?" And I said, "What's that?" And I was directed to a little tiny Chinese lady in San Francisco named Teresa Hong, and she was a miracle worker. The first time I saw her, she worked on me and sent me home. Nothing happened. I went back a week later and I said, "Are you good?" And she said, "Yeah, I'm good." And midway in the second week, all of a sudden I could sleep lying down for the first time in 6 months, and that got my attention.
Wow.
And over the course of 3 months, I was completely off all my meds. I had my life back and I was symptom free. And that was cheap at the price, whatever it cost. And she said, "Okay, you're fired. You can go now. Or you can stick around and I'll unwind you so this doesn't happen again." And I said, "Okay, I'm in." And then she tricked me. And she said, "Now, you know what I'm doing and you should go to osteopathic college." And at the time I was 45. And I had just gotten married. I had a wife with a standard of living to which she'd like to become accustomed. And student poverty was not in that equation. And I told Dr. Hong, "I'm not doing it." And 2.5 years later, we conceived our first kid. And I realized that my engineering career was not in a place where I wanted it. And I needed to do something I'd love every day for the kid, for me, for my family. And all of a sudden, I remembered osteopathic medicine and what Dr. Hong had said. And that very summer, a couple of months later, we closed down our businesses in San Francisco, moved to Maine, and I started in a year of pre-med and then went to medical school and pediatric residency after that. So I'm a pediatrician. My experience was that I had absolutely no opposition in all the things that I needed to do, which was very nice. So I was going to do a practice like Dr. Hong did, which is 100% manual medicine practice. I diagnose and treat with my hands. I take thorough history and I do all the things that other physicians can do. The thing that's special about osteopathic care is that we are taught to palpate and diagnose with our hands, and we're taught to recognize that many complaints may be structural and may need surgery and need to be referred to physicians who do surgery. But those of us who practice traditional osteopathic medicine are dealing primarily with functional complaints. We're dealing with complaints that result from our bodies being used in a way that's different from the way they evolved to be used. That's the work I do. I'm primarily a physician of last resort. I get patients after they've been to many other doctors, and I'm able to help them usually.
That's awesome. Have you worked with any athletes during your career?
I work with a fair number of athletes. I work with athletes all the time. Athletes and kids are my two favorites. Kids because they're unpredictable and they can do anything, and I really like that because they all teach me something. And athletes because they're in tune with their bodies, they're present in their bodies, and they're using their bodies to do what they want to do. And they are highly motivated so that they can be engaged in a course of self-care that's going to make them independent of me in fairly short order.
How do you train an athlete's mind? Now, I know it's all mental. How do you train their mind to help prevent illness and injury?
I teach a model of how it is that our bodies work. And it's different from what other disciplines teach. I teach a model of how the human body works and how it responds when something happens, when there's an injury or something like that, and how you yourself can treat that and resolve the problems and maintain yourself then. So whenever you have an injury, what happens is your nervous system imposes some restrictions on your movement such that you can function as best you can in the presence of the injury, and then you convalesce, and then you're better. And that's what your body does. When your body does that, your body establishes some habits that are helpful during the initial injury and the convalescence, but that then become restrictive after their utility has expired. And those restrictions are additive, and so this is what we call old age pains. It's the imposition of contractions within our bodies that we can't control, that limit our motion, that have no beneficial value after the original injury has been completed.
So working with the New York Yankees, I see a lot of MLB players and even the minor league players experience Tommy John surgery. How do you prevent this from happening?
So Tommy John surgery is a response to the disruption of some ligaments that are in the elbow. Forearm, the bone that's called the ulna that goes from the tip of the elbow to the wrist, the bump in the wrist below the little finger, and the upper arm bone, which is called the humerus. There are ligaments, and what a ligament is it's a piece of connective tissue that holds two bones together. If you were to look at the skeleton of a person, you would see a pile of bones, and you would see pieces of connective tissue that connect those bones. And if you pull it up from the top, you have a whole skeleton of a person standing there. The ligaments are the connective tissue that hold bones together. And when a pitcher, particularly, or there are other injuries that will cause it, but mostly pitchers, when the pitcher is accelerating their delivery to snap the elbow and wrist to let the ball go fast and hard, there's a tremendous amount of force placed on those ligaments that connect the upper arm to the forearm. If there's restriction of motion in the shoulder, if the shoulder is at all tight and if the forearms are tight, then the amount of force that's on the ligaments between the upper arm and between the upper arm and the forearm, the force on those ligaments is greater, and at some point those ligaments can rupture. When that rupture happens, that's the Tommy John injury, and the Tommy John surgery is taking a tendon from somewhere else in the body, which is a connection between muscle and bone, and drilling some holes in the upper arm bone and in the ulna, the forearm bone, and making a figure of 8 connection and drawing it tight, almost like you were putting a piece of string in through some holes and tying them together to hold the elbow and the upper arm together. That's the Tommy John surgery. The problem is that it never works as well as the original that we get when we're born. Prevent the injury rather than repairing the injury. And Tommy John doesn't think highly of people having the Tommy John surgery, and Tommy John's son has even written a book about the importance of avoiding the injury so that the Tommy John surgery isn't necessary. And the big concern is that there are kids who are like 10 years old who are getting Tommy John surgeries, and people are going, well, why don't we do the surgery now so that the arm will be better? Well, the arm is not better after you do the surgery. It's compromised in function thenceforth. Avoidance of the surgery by athletic training that teaches relaxation of the muscles in the shoulder and the muscles in the arms will result in increased freedom of motion. And that freedom of motion will then allow the pitch to be thrown without stressing the ulnar collateral ligaments, which are the ligaments that fail, that require the Tommy John surgery when you've got an overdeveloped shoulder or tightness in the shoulder, the upper arm, and the forearm. So that's the avoidance. The avoidance is learning how to relax the muscles that tend to be tight over the use of and the development of strength and vision.
Now, how long does this take before training, before a hard workout? If you do all these trigger pointing and loosening all these muscles, how long does that process take?
You can get it down to less than a minute to release a shoulder and have full range of motion and freedom in the shoulder. You can do that in less than a minute once you know how to do it. And, you can release the arm, meaning the upper arm and the forearm, in another minute. You can totally relax an arm, a shoulder, an arm, and a forearm, and get the ribs moving better and get the neck moving better, all in the space of a couple of minutes.
So you can develop this at a small, like 10 years old, 12,
well,
13?
yeah. Somebody who's a kid is going to need some support from the parents or from his coach or trainer. Kids are capable of understanding the process that is going to give them improved function and longer functional life in the arm and shoulder.
So for those baseball players that had Tommy John surgery already, how long does it take to fully recover to 100%?
Ooh, probably 18 months.
18.
And the 100% is not really the 100% that was there before.
Yeah.
But it's 9 to 18 months of recovery for Tommy John surgery.
What advice do you have for all Major League Baseball players and minor league baseball players entering their season?
That they could all be treated by somebody who understands the fact that longevity of function and superiority of function depends upon being able to relax all the muscles. When you relax a muscle, then you have the maximum contractile capacity with that muscle. If a muscle is partially contracted when it's at rest, then you can't fully contract the muscle because it's already partially contracted. And so whatever force you're going to put into the work you're doing is going to be put in using only part of the contractile range of the muscle and not the full contractile range. So what you really would like to do is have a totally relaxed arm that is able to just hang there and then be able to go to total contraction and control of the arm at the point at which you let go of the ball. And then you want to be able to totally relax it again. You don't want it to stay tight at rest, and you don't want it to stay tight between the pitches. And that's something that's not taught.
So you have a lot of knowledge on the human body. How do you expand your knowledge every day? What is your routine?
Well, my expansion of knowledge is seeing patients. Every patient that I see teaches me something, and that will keep me young until I'm much older. And that's the great joy of my work is that every patient teaches me something, especially the kids.
Yeah.
And the other things I've learned is that I have learned to treat myself while I'm treating a patient, and so that's my treatment. I got out of residency and started my practice 15 years ago, and every day I learn something, which is really nice. That's the most important thing to me.
What was your biggest challenge? Was there a project that you had faced that was very tough?
Initially, the biggest challenge in medical school was we are taught that the locus of health and wisdom, the place where the health and wisdom is in the medical encounter, is in the doctor, not in the patient. That's insane. You can't take responsibility for somebody else's body. You can serve them, but you can't fix them. You can set a broken bone, but you don't heal the bone. The patient's body heals the bone. The notion that my practice exists to serve the inherent tendency toward health and help and assist patients in recognizing that they can treat themselves and maintain themselves, except for illnesses that require assistance from somebody who knows how to do things like surgery and other mainline medical specialties.
If the Mark now can talk to the Mark 10 years ago, what would you tell yourself?
Keep doing what you're doing, and that's what I've done. Yeah.
Wonderful. So I want to thank you for taking the time of your day and talking about Tommy John surgery and everything we need to know about the human body. And hopefully MLB players and all minor league players take your advice and continue to move forward and strive for all their goals. Thank you so much.
Thank you for the opportunity to talk with you.
Thank you.